Imagine for a second you're lying flat on a slightly chilly, firm medical exam table. Maybe you hear a gentle hum from a massive, kind of intimidating machine wrapped around you, or maybe there's a large, square camera hovering just inches above your chest. You're probably feeling a little anxious, right? Just eager to get the answers you need for your health. Well, welcome to today's Explainer, where we're going to unpack exactly what happens in these crucial moments of medical imaging. I'm really excited to guide you through this because we're looking at a fantastic breakdown by Kelvin Lindsay, a medical radiographer and radiation safety advocate. We're going to uncover the hidden science behind those moments on the exam table and find out why your role in that room is literally just as vital as the machinery itself. If you've ever had a scan, you know these words perfectly. The radiographer's voice comes over the intercom or from behind that thick, lead-lined window, giving you those universal instructions. Please stay still. Don't breathe for a few seconds. Hold your position. In the moment, it can feel a little bit like a high-stakes game of freeze tag. You suddenly become hyper-aware of every tiny muscle twitch, your heartbeat, that natural urge to just take a breath. It feels strict, almost demanding. But these commands aren't just arbitrary rules to test your patients or make the staff's lives easier.
Okay, let's dive into this, because this core question is actually the key to your entire healthcare journey in that specific moment. Why do radiographers ask you to stay perfectly still? Like, why should you absolutely obey the instructions given by the radiographer? Well, it turns out your stillness is the absolute foundational ingredient for a successful scan. Without it, millions of dollars of cutting-edge medical technology simply cannot do their job.
Section 1. The blurry image problem. To really understand why, we need to pull back the curtain on what's actually happening inside the machine while you're lying there. Think about taking a photo with your smartphone in very low light. The camera needs a little extra time to absorb the light to capture the image, right? If the person you're taking a picture of moves even a fraction of an inch while that shutter is open, what happens? You get a blurry, smeared photo. Medical imaging works on a very similar principle. But instead of trying to capture a nice family portrait, these machines are trying to capture the intricate microscopic details of your internal anatomy. Even a tiny movement, a cough, a deep breath, just shifting your hip, can make those crucial anatomical structures appear totally blurred or completely distorted on the final screen. Your movement directly and immediately compromises the quality of what the machine is trying to capture. What's really interesting here is that radiographers actually have a formal name for this hidden enemy they battle every single day. They call it motion artifacts. Basically, a motion artifact is any blur or distortion in a medical image that's directly caused by a patient moving during the scan. It's kind of like static on a radio channel. It scrambles the signal and completely obscures the clear picture of your anatomy that your doctors desperately need to see.
Section 2. Escalating the stakes. Diagnosis and radiation.
So what does this actually mean for you? That scrambled picture is where we move from just a simple mechanical glitch to a really serious clinical issue. First off, important medical details like a tiny fracture, a really small nodule, or a subtle sign of inflammation, they might become incredibly difficult or even completely impossible to see. Because of this, it becomes so much harder for the radiologist to accurately interpret the examination. They're essentially trying to read a blurry map. Ultimately, this can directly affect your final diagnosis. An unclear image could literally lead to a misdiagnosis or a delayed treatment plan. This is exactly why you are asked to strictly obey the instructions given by the radiographer. Your stillness is, for sure, protecting the accuracy of your diagnosis. But the stakes actually escalate even further. Let's walk through this chain reaction of movement. Step 1. The patient moves. Step 2. The machine generates an unclear, blurry image. Step 3. Because the doctor can't use a blurry image to safely diagnose you, the examination has to be repeated. And here is where we hit Step 4, which is a major, major concern for radiation safety advocates: additional radiation exposure. In exams that use X-rays, like standard radiography or CT scans, repeating the image means exposing your body to a second, entirely unnecessary dose of ionizing radiation. This step-by-step chain reaction really highlights the urgency here. Holding still isn't just about image quality, it's an absolutely fundamental aspect of your own radiation safety.
Section 3. Different scans, different rules.
Now, while stillness is always important, the rules kind of shift depending on the specific technology you're dealing with. For a standard X-ray, it's fast, like a flash photograph. The instruction is usually just to remain still, and you might be asked to hold your breath for a few seconds, just to stop your chest from expanding and blurring your ribs or lungs. Next up is the CT scan. These are very fast, spinning around you in literally seconds. But because they're capturing extremely thin, high-resolution slices of your body, remaining perfectly still is absolutely mandatory to produce sharp images.
But then we have the MRI. An MRI uses powerful magnets instead of radiation, but the examination takes much, much longer. We're talking 20 to 45 minutes, sometimes more. In an MRI, staying still is critically important. Because the machine takes so long to gather data for just a single image sequence, a sneeze or shifting your position halfway through can ruin several minutes of scanning. The longer you're in the machine, the harder it is to stay frozen, but the more critical your stillness actually becomes.
Section 4. Partnering for the best results.
So when we actually understand the mechanics and the stakes, our whole perspective changes. Your stillness shouldn't just be framed as passive obedience. When you're on that table, you are an active, vital partner in your own healthcare journey. Your cooperation, your focus on holding that breath, on not shifting your leg, is exactly what helps the clinical team obtain clear, diagnostic quality images. You are the one minimizing unnecessary repeat imaging. You are the one protecting yourself from extra radiation. By choosing to obey the instructions given by the radiographer, you're making sure the team gets it right the first time.
I think our ultimate takeaway today comes perfectly from Kelvin Lunsey himself. He says, staying still isn't just an instruction, it's part of getting the best possible examination. The machine has its job, the radiographer has theirs, and you have yours. That momentary discomfort of holding a deep breath or of fighting the urge to wiggle your toes, that is a powerful contribution to your own medical care.
Have you ever been told to hold your breath during an X-ray or CT scan? Well, you now know exactly why. Next time you're lying on that table and hear the words, "Please stay still," remember this. You aren't just following rules. You are in control of the technology. So, are you ready to be the most important active partner in your next medical scan? Thank you so much for joining me for this explainer, and as always, keep learning.